COVID-19 Boston Arts Sector meeting. Please feel free to introduce yourself in the chat as people continue to trickle in, and we're going to get started in just a moment.
Okay, hi everybody. Happy Friday. It's good to see everyone. We are going to do some health and city updates, have an update from MassCreative. We're going to look at a city template for reopening guidelines and then open up the conversation for some feedback on thoughts on how we want to continue this meeting going forward. So I just want to start, let's see, go to the next slide, please, with our public health updates. So as of today, there are 13,382 confirmed cases, 703 deaths, and over 9,000 recoveries. And I just want to go over some of the public health metrics that we've been keeping our eyes on in the last few weeks. Average new cases in Boston came down by 50% from June 4th to June 17th and continue to decline. The city's overall positive test rate is down to 17.9%, and last week's test rate was 1.9%, which are both new lows. The number of COVID patients in Boston ICUs is down by 87% since the peak in April. So this is all really good news. These are all signs that things are going in the right direction. But at the same time, if you're looking at the news from around the country, this week has also had the most new cases of any day since COVID began. Actually, it's from the New York Times as well. The United States on Thursday reported more than 40,000 new coronavirus cases, a record total for the second straight day, with caseloads soaring in southern and western states that were far removed from the worst early outbreaks. So if we go to the next slide, this is a map also from the Times showing hotspots from the last 2 weeks. So in some southern and western states, the virus has overwhelmed hospitals and forced officials to stall on plans to lift virus-related restrictions. On Thursday, the governor of Florida said that he did not intend to move to the next phase of reopening, which seems pretty clear from this map. And the governor of Texas paused his state's reopening plans. In Orange County, Florida, home to Orlando, they're averaging 353 new cases a day, compared with 73 new cases a day 2 weeks ago. So the mayor of Miami-Dade County has said that all plans to move forward are on pause. Beaches, malls, and hotels are open, as well as restaurants at 50% capacity, but concert halls, public pools, massage and tattoo parlors are not. So I just wanted to share some of this, which I'm sure everyone is seeing in the news, because there's really no doubt that rushing into reopening is going to create a second surge and require us to go back to an earlier phase. And that's what we're seeing now from around the country. The mayor and everyone is from Public Health Commission is stressing to please not reopen unless you're ready to do so safely. And as a reminder, safely means meeting state and city guidelines at a minimum. There are going to be particularities to your space and to your practice that won't be captured in guidelines from city or state government. So one of the things that we're looking into, knowing that guidelines won't answer every question, is lining up some experts who would be able to answer specific questions so that you can have access to as much public health expertise as possible. Next slide, please. I also want to share some updates from the city. There were a lot of updates this week, and they all had to do with recovery and equity. From last week, also a lot of updates, reforms in the Boston Police Department policies, creating a task force to further review police policies and police oversight, the declaration from the mayor that racism is a public health crisis in the city of Boston, and moving 20% of the police overtime budget into services around physical and mental health, youth, and other really important services. This week, we got the announcement that the mayor is creating a new equity and inclusion cabinet. with the goal to drive work to dismantle systemic racism and embed equity in all planning and operations moving forward. And this is a really big restructuring. The cabinet will group the offices of resilience and racial equity, diversity, language and communications access, women's advancement, immigrant advancement, and include the Human Rights Commission. The mayor also created a Boston Racial Equity Fund, which will invest in nonprofits that empower Black and Brown residents in economic development, public health, youth, employment, education, the arts, and more. And the last announcement, major announcement this week was about equity in housing. So the city will be filing a new zoning amendment that requires developers to do more to fight displacement and promote inclusion. And this includes creating a project assessment tool to assess the risk of displacement kind of development project by project. So this is a lot of information, and we'll send this in the follow-up as well. We're definitely energized to connect the Mayor's Office of Arts and Culture and the libraries to all of this work and make sure that arts and culture are part of the process and the solution, and that we see the impact of this in our sector as well. And with that, I think we'll go to the next slide and turn it over to Emily if she is here.
I made it. I'm so sorry. And Christina is being kind enough to refresh the deck. So Christina, if you don't mind refreshing the deck and posting it again, that would be great. Thank you, Cara, for that update, particularly on the work around centering racial justice in all of our efforts. That's a space that we're also thinking a lot about. So Christina, have you been able to repost the deck? Or share your screen again?
Sorry, yeah, I'm doing it right now. It took me like.
Oh, I'm sorry about that. I'm sorry.
Right.
So I may have you flip through, so I want to be cognizant of time. So I'm just going to give a real quick. There's one thing on the federal level that we're monitoring, and we feel like it's really important for our sector to really sort of pay attention to, which is the Pandemic Unemployment Assistance Program. So I'm sure many of you are if you are on that PUA, are reaching the end of that, and there's some real concern that won't be extended. Thank you so much, Christina. It won't be extended, and that the $600 additional amount that was part of the CARES Act won't be extended. So both of those things are in the HEROES Act, which got passed out of the House and is now sort of hanging out over on the Senate. And so two actions were stood up. The Actors Equity stood up one that's very, very specific to theater artists and specifically actors. And then Americans for the Arts also has an action alert that you can send to Senators Markey and Warren. The reality is both Senators Markey and Warren are going to support the HEROES Act and are going to support this particular piece of the legislation. So you don't need to write like a fiery email if you choose to do that, but you can write a note and just remind them that this matters and this is important to our sector. Communicating even in a space where about like our needs really matters in this moment on all levels. So thanks, Christina. If you'd move on to the next slide. So then on the state, so we have been tracking a lot of things having to do with money this week. So in the state budgeting finance process, there's the annual budget, which I think we've all talked about, and then there's the supplemental budget or the SUP. And these come out regularly, and they're basically like a way for the administration to pay their bills. And then also make sure that if there needs to be adjustments to some things that were part of the budget that can't be paid for, they do it there. It's also a place where it can be an easy place to move other pieces of language or language fixes that you want, or other pieces of legislation you want to see happen. And we saw that happen with this final supplemental bill this week, that when the House took it up, Representative Williams included an amendment to make Juneteenth a legal holiday, and it was included in the passed version that went over to the Senate. So now the Senate will take that up. I just want to acknowledge that the the Black and Latino Legislative Caucus has been on top of this, and this is one of the things that they included in their provisions. And so this is not something, it's gotten a lot of support from both the House and the Senate. So it's not something that we're worried about, but this is a great opportunity to reach out to your state senator and just say that you're in support of that, of making Juneteenth a legal holiday. So that'll go to the Senate, and then hopefully it'll just go straight to the governor, and we will finish out fiscal year 20 in terms of paying all the bills. Then there's an economic bond bill that actually had a hearing. It's actually going on right now. And this bill was filed by Baker, I think it was literally March 1st. And it's basically like every year, it's an economic development bill. And so it was filed on March 1st, and a lot of things have happened since then. So we are betting, we're really crossing our fingers that what that bill becomes is really an economic stimulus bill. We are going to submit testimony to that committee that says, as you're thinking about revising this bill and thinking about using this as a vehicle for economic stimulus, please include the creative community, both our organizations and our businesses, as well as our workforce. And so we'll stand up. It's not ready quite yet. A testimony, you can submit testimony through Wednesday. We'll stand up a little how-to guide on our website and share that on all of our channels and with Cara and Pascal. Then the final piece is that the state budget, this year's budget for fiscal year 21 that we're about to technically go into is stalled again. So the House and the Senate passed a 1/12 budget, which will basically keep the lights on for the state. And I believe yesterday Baker signed that into law. And that's basically, it's just level funding, nothing, it's just make sure people get paid in state government. They can keep the lights on. The House was supposed to have a draft on July 1st. They have already announced that is going to be delayed. And I think 2 days ago, Baker said in a press conference that the reality is that they need more info on tax revenue before they're able to do anything related to a long-term plan for fiscal year 21. This has to do with the fact that the filing deadline was moved from April to July. So July 15th to be exact. So we expect to see more information, and they'll be able to start moving that process. But the fact that the legislature took up the SUP budget this week and is looking at that economic development bill and it worked on that 1/12 budget means that they are getting rolling, and we're going to start ramping up our advocacy into the building. So we only do that honestly in partnership with all of you. So we will be sending out alerts and hope you will join us in that. Christina, would you move to the next slide? So then reopening the state. So there was some expectation that this morning at Baker's press conference, he would announce officially that the phase 3 has been moved to July 6th. I don't think that happened, but we are still obviously waiting for that to happen. We are still looking for any questions or feedback you might have that you are hoping to see answered in the materials that are put out for phase 3 by the state. I literally have my phone right next to me. I'm expecting a call from the administration today to seek feedback from the arts and cultural sector. So if you have any feedback that you'd like to make sure gets included in that conversation, we've got a form that is hyperlinked here. Then the last thing I want to talk about in terms of the state is education. So yesterday, DESE released, that's the Department of Elementary and Secondary Education, they released their initial reopening guidance. And this is basically like, okay, schools, get ready. Here's what we need you to prep. Schools have to have a plan for in-school learning, remote learning, and then a hybrid model. They also are being instructed to keep students in smaller cohorts or pods, or if in the elementary school level or primary school level, just in classrooms. And then there's obviously increased cleaning and sanitizing procedures. Because I know many of us run organizations or our business is based on working with schools. I wanted to flag this. There's a hyperlink in this deck, which Pascal will send out after the meeting, that'll take you directly to that guidance. The thing that's important is none of that guidance is about, okay, schools, this is the curriculum that we think you should push, or like, these are the standards we want to make sure you cover next year. It's literally like, how are you logistically going to open your buildings? But that doesn't mean that we don't expect that to come, and that we are not working in coalition to make sure that we are protecting arts education for every student, regardless of zip code or school district. And there's a link in here where you can write to your legislator tighter about funding. And it's not just really for arts education, but it's also basically funding for education, because as we just said, there's so much uncertainty about revenues and how much money the state will have. We're really concerned about two pieces of funding that go to schools. One is Chapter 70B funding, which specifically goes to schools with a higher number of Title I schools, or excuse me, goes to cities and towns that have a higher number of Title I schools. And then the Student Opportunity Act, which is about closing the achievement gap for students. And both of these really are an equity issue around making sure that everyone can access a well-supported education, and school districts have the money to do that. And so we believe that this is part of our work, and we are fighting really hard for that in this moment. We hope you'll join us. So then finally, these are, Christine, if you don't mind moving to the next slide. So two other things. So the first one is earlier this week, MassCreative, in partnership with our steering committee members and partners, launched Create the Vote. This is really focused on how the creative community is going to play a role in ensuring that we protect and strengthen our democracy. So it's about voter education, registration, and then voter turnout. And we hope all of you will join. We are interested in individual artists and creative workers and culture workers, as well as organizations joining us in this work. And then finally, make sure you are taking the census. You have taken the census. October 31st is the deadline for self-reporting, and please ensure you connect that with your networks. All of this work is the work that the creative community should be paying attention to, and that we are glad to support for all of you in partnership. So that's what I've got this week.
Thanks, Emily. I tried to get some of the links in there if people want to click right now. Great. So with that, we're going to move on to the next part of our agenda. In a minute, I'm going to turn it over to Courtney Sharp, our Director of Cultural Planning in the Mayor's Office of Arts and Culture, to walk through the template of city guidelines and how we're thinking about amending that for phase 3. But I wanted to put a big caveat here, which is that we still are waiting on some pretty significant pieces of information. So some of those include what the capacity numbers or percent of capacity are going to be for indoor venues and spaces, what the new gathering restriction numbers are going to be, including for outdoor spaces. And that's going to really inform a lot of what's possible outside and what the city of Boston is comfortable permitting for special events in parks and on city property. And I know that we still are getting a lot of questions about that, and we have questions about that too. You know, we're waiting to see what is the state going to make allowable in phase 3. The definition of small and large events and venues, I should say. So, you know, what size indoor spaces are going to actually be allowed to reopen, or is it actually going to be about capacity? You know, what's the cap on that? We really don't know how to interpret that yet. And then whether or not there will be sector-specific recommendations, even discipline-specific recommendations, like around questions that folks have had about singing, you know, around questions like how people can rehearse with or without masks, and will there be any more kind of level of detail from the state on that or not? And that's another big one. So I wanted to put those out there first, and also say, you know, we're gonna just screen share and literally show you a Google Doc. So this is like circle of trust. We're all best friends. We're not sending this out by PDF. This is just like us popping the hood so that we can start to get some feedback from you ahead of time. So I appreciate everybody engaging with it in that spirit. And we know that there are things that are going to be missing. So I think with that, I will hand it over to Courtney.
Hi, everyone. I'm going to start sharing my screen, hopefully. Let's see. Can I get a thumbs up if you can now see this document? Great. So as Cara said, this is highly draft. So we're not going to be sending it out afterwards because a lot of it is subject to change. And to give more context to what you're seeing, for each of the phases, the city has been working on a template. So there is a base template. So a lot of this is standard text. And so what I'm going to be walking through is what is different that particularly pertains to our sector. So we are creating a cultural organizations and performance venues document instead of perhaps doing more individual, such as theaters and museums, because we think that a lot of the information is relevant across individual organization types. So just to give a bit of framing in that regard. So the way this document is structured, there are 4 sections I'm going to scroll through. Before I scroll, I want to put this in mind for you that we want to hear what you feel like may also be missing or what may be additionally helpful. So as I'm going through the sections, please take notes of things that you think would be useful as we actually enter phase 3. So this document itself, the base template was created for phase 1, and for each of the sectors that come, it's being updated accordingly. So the sections I'm going to walk.
Got a request in the chat just before you keep going. Is it possible to zoom in on your text a little bit or increase the percentage so that folks can read it a little bit easier?
Yes.
Okay, thank you.
Is this better? Hopefully. Great. Okay. So the sections to follow. There will be a section on social distancing, hygiene protocols, staffing operations, and then cleaning and disinfecting. So I'm going to scroll through and then pause on the things that have been highlighted that may pertain more to us. So a lot of this is boilerplate text that responds to what the state is doing and what they have provided as general guidance. So these are not things that the city is responsible for coming up with, and they're also not things we have the ability to change. So this is the social distancing section. So this is identifying 6 feet of social distancing and things that we are now all pretty much familiar with. So in the City of Boston operational recommendations, some of the things it includes are concession and dining, which may apply more to us, and then dressing rooms. This is something that's more unique to our sector. Another thing that is of particular interest may be the common spaces, entries, and lobbies. And I will say that some of these things are repeated in later sections because it's divided by use rather than topic. So if you see something that's missing here, it may come up later in the document. We know that lobbies are definitely of high use in the arts sector. So these are things that will come up later as well. So dance and performance studios is something that is particularly unique to us. So this is something that is also being proposed where social distancing should still be adhered to and maintained as best as possible. And we know that may cause particular challenges. Hygiene protocols. This is the thing that stands out here for us is really as it relates to mask wearing for performers. So the base of this template is more for offices, and that's normally pretty sedentary work. But in our lines of professions, it's possible that people may be moving around a lot. They may sweat. They may need to change out the mask or pay special attention to masks that may not retain moisture as much. So this is something that's unique. So for staffing and operations, this is a section that has more robust things for us. So again, this intro section is more related to state standards, with the exception of what's in green here. So in general, limiting visitors, but we know that we really rely on visitors. So we're limiting visitors outside of performance times. We're looking at how to have teams of folks who can come in at staggered times, but also recognizing that a lot of the work in the arts and sector is by nature collaborative. So looking at how that can be staggered appropriately for the sector. So one of the things that we are hoping for more guidance from the state is this part in yellow, where typically they're asking of office workers to stay at home or arrange for alternate work assignments, but that can be particularly challenging for some of us if you work, for example, in the performance industry and you need to work together to actually put together a performance. So this is something that we don't currently have more guidance on, but we're open to suggestions, and we're also hoping that state guidance will come at a later date. And our city-specific ones, something that we are requesting is a workplace coordinator, and this is across all sectors, and that may not be something that was on the radar. So what I'm scrolling through here is, again, more operational about who can come in, how. And I'm scrolling down to the parts that are art specific. So for concessions and dining, which may be a part of your operations, they are largely wanting to have that be eliminated or limited to prepackaged goods. And then for installations in retail, this is also more unique to us, looking at how things can be done to allow for curbside pickup, and making sure that that safety protocols as it relates to social distancing can still be maintained as people engage with the space or the retail items themselves. This section should also have been highlighted, rehearsal and performance guidelines, the questions about what is appropriate and what should be the standards for when people are rehearsing. I think in general, as much as possible, rehearsals by virtual means are suggested, but we do recognize that at a certain point, people will have to rehearse in person and potentially perform in person too. So there is a real question about what will performances look like in the future, but I think that's also going to be responsive to what do communities want to, what are audiences' comfort levels with actually attending spaces. So these are things we're hoping to get more guidance from as time progresses. Will masks be required for the performances? This is something that for the audience, yes, it will be required, but there is an outstanding question about whether or not that will be required for the performers themselves. And we know that there are certainly going to be implications about what that may mean, both for the physical component of performing as well as how that may impact the artistic nature of the performance. So these are things we're currently working on in process. So this next one here is also related to dancing and singing, but we want to minimize the ability for droplets to be or to contaminate other folks. So we want folks to be positioned in the same direction rather than front and back. Physical barriers, this is something that has been discussed across sectors, and it's something that is still under development for how it may apply to the art sector too. So for ticketing and box office, this is something that should have been highlighted, but really trying to encourage online or digital only ticketing. The thought behind that is how to minimize hand-to-hand contact. So if there is a way to allow people to prepay by phone if they don't have a credit card, or additionally set up a means for limited cash options for those who don't have access to credit cards, that's something to keep in mind too. And we have in this section also maintaining queuing, those things that are generally related to social distancing. Valet parking may also be more unique to this sector. And then outdoor events. So outdoor events is something we're really looking for guidance from the state as well as from other parts of the city. There's currently a lot of conversation going on now as it relates to phase 2 and well, not phase 2, phase 3 it is still, but the outdoor physical education gym components. So we know that that is being allowed to advance. So we're hoping that there will soon be more guidance for what can be allowable for arts performances too. So this next section, cleaning and disinfecting, is the last section, and there's not much here. I'm gonna scroll through to make sure. This is pretty much standard. And that's actually the end of it. So with that, I'll stop screen sharing and I think I'll turn it over to Pascal. But again, what we're really looking for is your feedback for things that were not covered here, that you would like more guidance on, or things that were covered, but you feel would need to have more details to be more useful for your plans for reopening. So thank you.
Thanks, Courtney. We do have 2 questions already in the chat that I think we can address before we move on. Ken Pierce asked, what about air handling requirements in rehearsal or performance spaces?
Could you repeat the question? Sorry, I didn't catch that.
Yes, no, of course.
Or-
I said, so Ken Pierce asked, what about air handling requirements in rehearsal or performance spaces? Any guidance on that?
I don't have guidance for that now, but I can certainly take a note of that. I think all the questions that are put in the chat, we can download the chat and go through and add those to our to-do list as we're building out these for release.
Yeah, and I think that the template that we're using that's being used for all of the guidelines references either state or CDC. It might just be CDC air handling requirements. So that's probably, if you've been looking for those, what you've already seen. It's not to a higher standard than that. So I think something that we need to answer for everybody on this call and for this sector is to get the technical assistance provider that the city has contracted to actually look at those standards and see whether or not we would want something that's more thorough than what is currently being recommended for something like a commercial space or an office space.
Great. Any chance you could post the CDC air handling requirements? We haven't found those. And then Matt Chaperon asked, am I seeing the headlines here that 6-foot distancing will be required by the city for audiences and requiring performers to wear masks on the table? If so, when do these requirements end? What metrics will be required?
I think it is a correct reading that it's currently on the table. I don't think it's clear yet when the requirements will end. I think that's a very good question. I think it's a question of phasing in general. It's when do we get to we're back and everything is not back to normal. We don't want normal, but back to safe. And I think there should be another reopening sort of document, like a ramp up to how do we scale back down what some of these things are. But we're not far enough yet in that conversation. Right now, we're still in the ramp up phase. So I don't have a better answer for when they'll end, but that is a good question.
And I think one thing that relates to the performers wearing masks question is, the order of operations. Like if you have enough space, is there like a distance at which people don't need to wear masks? Is it outside where they don't need to wear masks? One of the questions that's highlighted in that document right now is about the distance between performers and audience. So there are a lot of other factors kind of surrounding how to mitigate risk such that we wouldn't have to require performers to wear masks. And that'll be part of what we also get some input on from the public health technical assistance provider that's contracted right now.
I know we're getting some more questions in the chat, but I do want to move over to our next section, which is to talk more about these guidelines, this template that we have currently. More or less, we're looking for how and what else would make the guidelines template useful for your work and organization, places that are shut down, what are the needs and support. And then the other bigger question, this is for everyone, and if we're asking speakers here to speak to that, and please in the chat mention your feedback and thoughts, what we're thinking the life of these meetings could look like as we're clearly moving forward in this continuing for a little bit longer. We really want to know how we can really use this time as best and effective so that everyone feels like they're getting enough resources or answers, questions to their answers to their questions. So for right now, I want to give Bradley from the BLO, Dawn Simmons from Stagesource, Emily Day from BCA, and Gary an opportunity to speak to what they're seeing this template is doing, how it's being effective for them, and what ideas or things that they think are missing, and we could be a little bit more to find more information about, or hopefully figure out what we could do to support those areas. So whoever wants to go first can just unmute themselves and start.
Hey everybody, it's Dawn. So I think my first question, and the thing that I think, and I apologize for being unclear on this, what is the process of review, right? An organization sort of lays out, here's all that I am doing, here are all the precautions that I'm taking, but then where does that go from there?
Yeah, so as of right now, there isn't a city approval process for plans. So these are guidelines that, like what's happening right now with small businesses or restaurants that are figuring out how to reopen or use outdoor seating. The guidelines are published. We make sure that people have them and can ask questions and give feedback. There are webinars and trainings on how to implement those guidelines. And then it's kind of in the hands of the businesses to take those on and figure out how to make them happen.
Mm-hmm.
I will say it's been interesting to see, like, there isn't necessarily an office that carries compliance for arts organizations, right? Whereas ISD does actively regulate restaurants. So you might have seen an article in the Globe recently that said people were complaining about how outdoor seating was going in the North End. And so there were going to be random kind of drop-ins to check on that. We don't really have an equivalent of that for arts organizations. And that really, that response really stemmed from people calling and, saying, people weren't following the regulations.
Right.
I think a question that I would have back is it useful? The city won't sign off on plans officially. Like, we won't review something and say this is good to go, but we're happy to look at something and say, have you considered this? Or did you think about that? We can always do that. It's just not an official sign off. I don't know how helpful that is.
I think it is. I think it's helpful just knowing that, like, great, we're trusting organizations, individuals, whomever, to be following these guidelines, and just for us to sort of know, like, it is on each company to, like, bear this out as much as they can. Great.
Hi, everybody. This is Emily Foster Day with Boston Center for the Arts. I think to that point, we've been looking at the guidelines. We've been taking them very seriously. We've been developing a plan for all of our spaces at BCA, which, it's sort of highly complex because there are, rehearsal spaces, there's performance spaces, there's obviously the cyclorama. And I think but there's also an absolutely enormous cost to executing on, like, the hygiene protocols and the sanitation that's called for in the guidelines. And so I think for us, it's a matter of, trying to understand better from the city about, I think we're getting conflicting information about sort of when larger groups can assemble. And I think or the capacity issue, is it 50% capacity of the room? Is it 50% of the normal capacity of the space? And really, because, at this point, if we're going to, spend what looks to be now $4,000 a month to increase our sanitation, to be in compliance, we want to make sure that we can actually, utilize the spaces in such a way that that we can offset those costs. So that's kind of the conundrum that we're in right now, is sort of like when to start and when to move forward, because we don't exactly know sort of how many people can be in each space, what is going to be within compliance for rehearsals, for dance, for theater. So yeah, it's sort of a push-pull at this point.
Yeah, I mean, that's definitely I think that's the big question that you've just identified, which is the actual numbers, right? Without that, how can we move backwards? So I hear you on that. I mean, I hope that we get some more heads up. I mean, Emily, I don't know if you've heard anything else. You said that hopefully there's going to be a chance for organizations to weigh in with the state reopening committee, maybe even early next week or this week. But I think it would be really helpful for all of us to get a little bit more of a glimpse of what's coming, even if it's a matter of like 5 days ahead of time, because the heads up that we're getting right now has just been like right before we enter the next phase. So it's almost like you have to build in however much time to figure out how to interpret what the state is going to say after we actually reach phase 3.
Kara, it's Gary Dunning from Celebrity Series. I'm just going to echo everyone. I'll be brief. The biggest problem we're all having is uncertainty. We are being just driven by uncertainty, and it's paralyzing because we can't do anything, we can't really plan. So I just would plead to ask people to be as specific as possible in as many areas as possible. Because even a simple thing like, are the performers going to wear a mask or not, will determine a whole lot about what could be programmed or not programmed. And of course, that advance notice you just referred to is so critical, because we can't exactly get the mandate, and then turn on the performance or the artist or the building the next day. I don't want to speak because we don't own a building or operate one, but we work in about a dozen different buildings around the city and to a venue. What we're hearing is we have to know we can open up for multiple performances because the cost of opening is so great. Remember how this all started? We just kind of ran out of our offices and ran out of the buildings. So all of them have to be completely cleaned and disinfected and all of that. And that cost doesn't make sense, you know, Emily said it, unless we know that there's a sustainable number of performances that are possible. And all of that obviously takes some planning. So we're just pleading for information as specifically as possible. And I think that'll help us all figure out what we can and can't do, and then come back with more specific questions. That's all, thanks.
This is Brad from Boston Lyric Opera. Thank you for sharing this with us today and for giving us the opportunity to share some feedback. One thing that is jumping out to me in this conversation that I didn't have a chance to see in the guidelines, and maybe they're drafted, is perhaps identifying different risk groups within the artist group itself. We at BLO and in the opera industry, many people are aware that it takes sometimes 150 to 200 people to pull off a single performance with onstage and offstage artists and creative personnel. And so gathering is a critical part of the traditional work that we do. We've had the chance to put together, to assemble a health task force for opera artists to start to think through specific health and safety concerns as it relates to singers and orchestral musicians who have been identified in higher risk categories because of the pedagogy it takes to produce singing and to breathe deeply for wind instruments and brass instruments. And as we were sort of skimming through some of these guidelines there, just questions in my mind started to come up in terms of, you know, are these guidelines, are guidelines for dancers the same guidelines for singers? Are they the same guidelines for musicians? Are they the same guidelines for theater artists, designers, et cetera? So if there's an opportunity to expand on that, and if there's a way in which BLO could support that conversation, we would be very happy to do so. If I can share another thought, we've talked a lot about theater facilities as well, and BLO and other organizations also operate in spaces that are not in the theater sector. And I would have questions about how these guidelines for the work and for the way in which we work, how these guidelines transfer across different industries. So if it's not uncommon that a Boston arts organization might be rehearsing in a fellowship hall or in a religious facility, or a facility that is not sort of captured in the theater and venue environment.
Yeah, that's a really good point. I mean, one thing that we've been, I think we were even just talking about it this morning, is that the guidelines are written by like use type of space and not by actual activity. Mm-hmm. So even when we're looking at, you know, for phase 3, who's going to be affected, museums, you know, instructional classes for adults, et cetera, you know, the way that it makes sense to me anyway to think about organizing information is by performance, rehearsal, like by the types of activities that are happening within the sector. There are some specific things, obviously venue by venue, but that's not something that we've really seen anybody else doing. So that's a really good question. And I think we should make note of that. What's the policy for if you're doing a performance activity in a space that's governed by a commercial, you know, phase 2 or whatever it is, guidelines.
I also wonder, Cara, and I know we're going to discuss sort of what the future of these meetings are, but is there a plan to have, you know, somebody available at the city level who can, you know, advise organizations or answer questions kind of one-on-one? Because I think one of the things that we're all grappling with is that we have sort of unique circumstances and unique spaces that may not fall within these categories. Is that essentially Pascal's function, or?
No, so I think part of what we're wrestling with is, you know, whoever's giving that advice needs to be a public health expert. Particularly if you're asking really specific questions. So right now we have within the work that we've hired this technical assistance provider for, like they have within that scope, bringing on public health experts to do webinars to help answer questions. That doesn't include one-on-one right now. I don't know. It's something that we can look into, how tailored that help can be. I think everything that's been opening so far has not been kind of complicated in this way. So they've been able to do, like one webinar for, like I was saying, for restaurants that are doing outdoor seating. And that's just a really different kind of level of complexity, I think, compared to what we're talking about. So we can look into that and see. The other thing that we can do is also bring on experts who are just kind of available for Q&A. And I think we can find some folks to do that outside of the technical assistance webinars. So we had a conversation some weeks ago now with Dr. Aaron Bromage from UMass Dartmouth, who was able to just answer a lot of questions and kind of give his thoughts and opinions as a public health expert on theaters specifically. So we can always reach out to him or to others to host an hour, use the hour that we have, or hour and a half of our Friday meetings, to make that person available for a conversation and question and answer. But in terms of the level of essentially a consultant sitting down with you to go over your plans in detail, that right now I don't see, but we can make sure that that's, we can double check to see if that's included in the scope of work that we have. Any other thoughts or reactions?
This is Brad again with BLO. Just going off of the comment that Dawn made at the beginning of this speaker session and the conversation that you were just having, it's making me think about the continuity for the artists' experience, their continuity across different organizations that they might be working with throughout the course of a year, and how we can provide a sort of a continuous environment and sort of guidelines for artists who are freelance, who might have a certain number of projects and a certain number of work days with an organization like BLO, and then be working with a different organization, and to make it as easy of an experience and sort of as easy as possible to understand what the guidelines are and that sort of the basic work environment expectations should be.
Yeah, I think that's a really good point. And I will say, we had a call with artists last week and earlier this week, and their concerns, it was a different kind of conversation than our Friday meetings that we have with organizations. There are a lot of concerns about how to engage with spaces as someone doing artistic direction, or as an artist, as a performer, as an employee. And that's a conversation that we're also having in other sectors as well. There have been a lot of calls from workers who are out now to the city saying, my workplace doesn't have safe procedures, or like we're not following the guidelines. And that's a whole other area too of how do we make sure that workers are feeling safe in multiple contexts.
Kara, then it's Gary. The only thing I might suggest is that that same conversation is happening with a lot of the unions.
Yep.
A lot of the performer unions that are setting rules, equity, AGMA, all of them. And so there might be something gained to sort of see the work they've done, because they have, at least as far as I've seen, gotten fairly specific about what criteria need to be met before we think a union member, should be allowed to work in that situation.
Yep, that's a great suggestion. I also want to call out in the chat, someone mentioned creating checklists for different scenarios. And I do believe that that's within the scope of work for the contractor that we have. So taking maybe a version of the guidelines and turning that into kind of like a case by case, like you're performing in a space, you're opening a space, you're running whatever program it is, and turning those things into checklists as well. I think we can provide that. Have people, just going back to the union question, are there plans that are being approved now?
I can share from BLO. I was actually just on a call prior to this with one of our union reps, our AGMA rep based in New York. So it's their national representation, and we were discussing the medical task force that they've put together to start to address some of these issues. And they were sharing that they've started to address this first in dance, and then we'll be moving into the singer space. And I can share that we hope to have a very open and collaborative relationship. Both sides desire to have a very collaborative relationship in that space. And BLO would be happy to share outcomes as well.
I know a lot of folks, or some folks, are starting to send their plans to Actors Equity for review. I don't know if there's anybody on this call who has sent and has had their plans approved. There's also no telling how long that approval process is going to take. But there's something about that, right? Like people are sending plans to equity, and there's some form of accountability. And so I think I keep bumping up against this. These are guidelines, but the city's not signing off on anything. So an organization could sort of tailor this to them, right? Like there are suggestions here, but you follow them to what makes sense for you fiscally, financially, what makes you feel safe, what makes your employees and creatives coming in feel safe. But like, does that leave room for so much interpretation that, right, that experience across the board, I don't know, is so different or opens us up for risk, right? That question of accountability is just everywhere right now. So that is what I think of as I sort of really start to wrestle with. These are guidelines. It's not like there's nobody that I have to be responsible to other than my constituents.
Yeah, the guidelines aren't going to protect you if something goes wrong.
Right.
Mm-hmm. Yeah. And I guess that's another question that I'd actually open up to the group is the question of liability. I mean, if they're just and again, like obviously none of us want to, to make any decisions that harm, any of our staff or our artists. But, because there is no accountability and there is no sort of approval process, how do we protect ourselves from that kind of risk?
You just have them sign waivers before they walk in the door.
Just like Donald Trump.
Erica, I'm wondering if you want to speak to what you just added into the chat about terms and conditions.
Yeah, so a couple of things on liability. We're looking into, hi everyone, just to remind you, I work for an international company and has several venues throughout the country. So part of it will be in the terms of conditions when the business invitee. Does everyone know about a business invitee? When you purchase a ticket, you are actually contracting with that venue that you will adhere to their guidelines. So you do, as a venue, which is interesting for all of you to know, that you do as the venue have the opportunity to disinvite someone off of your premises, which will be part of the liability concern. In terms of the liability for performers and or employees, that's part of what is holding up the conversations with the unions, because for larger touring shows, what they're trying to figure out is if someone suddenly does test positive, and this is actually following the guidelines that major sports leagues are using, in the concept of if they are creating pods or quarantining the team, they're thinking of doing the same with, for example, touring Broadway. But if someone does test positive, where does the liability fall in terms of canceled performances, where that pod is then quarantining? Are they then staying in whatever city they're in for another 2 weeks or what have you? Are they needed to return to their point of origin, whatever that may be? So that is part of what is stalling the larger touring conversations for rock musicians, Broadway artists, all of the types of things, because those are part of the guidelines that the unions essentially, whether it's Equity or IATSE, are all looking at, and where that liability falls. Those conversations are, I don't want to say they're in their infancy, but certainly The Broadway League has several task forces. Many of you have probably seen that Live Nation came out with some new guidelines about where they want performers and artists to secure their own insurance so that if an event is canceled, it's not falling on the presenter, it's falling on the artist to claim any fees that they lose out on. So these are things that, everything I'm talking about has really come to a head in the last week or two. And most of the response from those larger national touring groups are why everybody is really talking about 2021 for those types of events. That they really need the time to suss through these agreements, suss through protocols, and especially what we were hearing about a month or so ago is, hey, things are okay in Texas, so we can maybe play a few dates in Houston and a few dates in San Antonio, and we'll do like a mini tour. And obviously we're all now seeing that that has completely changed. So a bigger issue is because other states are now having problems where they weren't, the artists aren't going to take the risk of planning a tour that then they can't start a tour and then stop it. So that's part of what's holding up the issue. I think there will probably be more immediate success with smaller organizations that, like Dawn, you were saying, can put together a concrete plan to go in front of equity and say, this is how we're going to do this show. But in terms of liability, that is a huge part of the issue. However, as a venue, I can tell you the liability is very clear, is becoming clearer into focus for us in how we can, even, for example, if a mandate that we choose to say you cannot enter this facility as an audience member without a mask, if that is so the protocol, there is legal language, is my understanding, I'm not a lawyer, that how that even supersedes ADA requirements, right? So there's also been questions about people saying, oh, but I suffer from and I have a doctor's note. But in a larger setting, we're actually finding that the legal language is actually very clear that the terms and conditions of the venue, as long as they've been communicated effectively in advance, that's what supersedes. So we're looking at videos and PSAs and all the communications that we're going to be putting out once we're ready to reopen. Is that helpful, Cara?
Yeah, I mean, I'm thinking, Erica, that just from how far along you are in those conversations, it would be helpful to have you on to share some of that material, because that's really interesting, and I hadn't heard some of that before. I don't know if others had, but it would be great to hear more at a future meeting if you're willing to share where you are.
Yeah, always. Yeah, absolutely.
And I think this also goes to, so one of the questions here is, we're going to be in phase 3. There's going to be this kind of flurry of information, but I think it's pretty clear to everybody, right, that what the city and state is going to put out is only going to be so much. And so we can use this time to bring experts for Q&As, like we were saying. We can bring in other people who are experiencing this from different parts of the sector, maybe who aren't, they don't have to be here in Boston. They could be from wherever, to give us a sense of what's going on. We could curate that more, but I'm kind of curious, as we are in this time where probably, and already a lot of spaces and organizations are kind of going dark for a period of time, like what is really useful here, or are there sub conversations that might be useful for people who are in a particular discipline or kind of work that want to share information together? Like how should we best use the time? Yeah, Deborah's asking about how we're coordinating with other cities as well, which is definitely something that's come up. A lot of the convenings just around this in the last few months have included Cambridge, some Somerville, but there is, I think, statewide, a lot of looking around at each other to see, who's doing what and who has the capacity to provide more assistance. But we could also do that and bring in folks from other cities.
Hey all, it's Dawn again. I think for me, for some of our membership, right, staying dark until January, what kind of relief is out there for folks, right? It's probably everything that we've already heard, but is there anything new, right, as folks continue to furlough and we're hoping that everything can come back? What kind of assistance is available would be helpful.
Yeah, I think any ongoing, if we sort of think about the structure of these meetings, I think having, setting aside some information about different relief grant opportunities, particularly as it relates to, the expenses that each organization has to incur in order to continue to sort of move through the phases of reopening. I think from our perspective, the public health expert that you had on a couple of weeks ago was incredibly helpful, and although a little sobering, I think we could all, because none of us, I assume, are public health experts. I think we could all benefit from hearing the most sort of up-to-date research and information about the virus, because they're obviously learning as they go as well. I do hope that we can continue to have these meetings, because I think they've, for our perspective, have been incredibly helpful. I know it's a lot of a big lift on your end to get them organized and to get folks in, but this has been a great community to come to every week and really sort of share ideas and understand what other people are doing. So I hope that they'll continue.
If I may too, just one thing is, I think if we do move to phase 3, I think also some communication around why venues may not open, or the specificity around may help people understand how much the arts and culture sector is suffering, because even though it may be permissible, there's still so much more of a runway that is needed for all of us to have the art created, support the artists, get things up and going. I think that I know some other states that did not shut down immediately. Performing arts organizations came across some very angry patrons saying, but why aren't you having the show? And I think it's very important to keep the public aware, and I know we're all doing it individually, but to keep the public aware of your safety first, including audience and back of house and everyone else, and that just because we can physically open as a building doesn't mean that it's safe to do so. And I think that that might help that messaging as well in terms of the struggle.
Great. Any last thoughts?
Hey y'all, Dawn again, because I never stop. I think one of the things that I keep hearing as well are just now, as we are looking at this time, is this a time of merger, collaboration, different thinking of partnership? So if people are actually having those conversations, is there a way to bring that to the group to sort of talk about it so that we can all sort of, I don't know, be inspired, jump on board? But those conversations are happening in small pockets. It'd be nice to be able to think it through with everybody else.
Yeah, I agree. That would be great. And we can probably find some people who have gone through that process recently and have them talk about what that was like. Yes, we could do breakout sessions. We can mix it up. It doesn't have to be the presentation on Zoom. This is all really helpful feedback. I think, it's tough. Somebody in the chat wrote, it's frustrating to be waiting to be able to have more than 10 people, and you can have 50 people sitting outdoors dining at a restaurant, without masks. And I totally agree. It is frustrating. And I also hear everybody on funding. It's still something that we're trying to do internally to try to find some new sources to bring to the table for organizations. And I think we should be hearing back from the NEA about CARES Act funding in the next few days. And that's not going to be a ton of money. I think the other thing but it's something. I think the other thing that I've been wondering about, and I know that the state budget is in a tough situation, as Emily was talking about earlier, but a lot of these facility costs in particular are a really, really good fit for the MCC Cultural Facilities Fund, which has a lot of restrictions around it in terms of, how many how often they open that and what the cycle is. But it is also, there's a pot of money there that's specifically for facilities upgrades for arts and culture. So I think if you've been in that portfolio before, or if you got a grant in the last year and you're able to submit a project change or something like that to be able to cover some of it, I would be interested to hear from folks who have been able to leverage that funding, even though the timing is not quite right now. I think if that were a more flexible funding source, it would be amazing to see that open up and help people right through this time when we really need it. But we're going to keep working on it. And I appreciate everybody's feedback and participation. And we will continue to have these meetings, and we'll figure out, I think maybe even for next week, bringing Dr. Bromage or another public health person on will be really, really helpful. And hopefully we'll know more about phase 3 by then. Well, we will know more about phase 3 by then. We're not having a meeting next week because it's a holiday. So we might be sending an update over email if we have something, and if not, we'll see you the Friday after that. Great. Any last thoughts? Pascal, Courtney, Emily, anything else?
I'll be sending the PowerPoint soon.
Great. All right. Thanks, everyone. Thank you so much.